through all the extracted content. Here's a structured summary and clarification for easier understanding. Health and safety questions. 1. Neoplasm. Uncontrolled proliferation of cells forming clones, neoplasm or tumor. 2. Sharing needles. Not recommended because it can transmit HIV, hepatitis B, etc. 3. Child helpline. Provides social workers to help children with food, shelter, protection. 4. Physical abuse. Acts causing physical harm, threatening, beating, kicking, hitting a child. Or 5. Drug addict. A person habituated to drugs due to prolonged use. 6. Addictive drugs. Drugs that modify physical cycle behavior by stimulating, depressing, or disturbing body-mind functions. 7. Symptoms of sexual abuse in children. Genital injury, abdominal pain, frequent urinary infections, behavioral problems. 8. Symptoms of heart disease. Shortness of breath, headache, tiredness, dizziness, chest pain, leg swelling, gastrointestinal disturbances. 9. Glycosuria. Excess glucose excreted in urine. POSASO Protection of Children from Sexual Offenses Act 2012. Protect children from 1. Sexual assault. 2. Sexual harassment. 3. Pornography. Establish special courts for speedy trials. Drug de-addiction. Psychotherapy. Individual and group counseling by psychologists, counselors. Treatment includes reducing stress, learning problem-solving skills, proper diet, rest, and relaxation. Child abuse overview. Physical abuse. Acts causing physical harm, threats, beating, etc. Child abuse. Any physical, emotional ill treatment, sexual abuse, exploitation affecting child's health, survival, development. Preventing smoking. Awareness of dangers, proper counseling, avoidance of tobacco products. Alcohol and its effects. Nervous system depression, nerve cell damage, mental, physical disturbances. Poor coordination, blurred vision, accidents. Heart problems due to vessel dilation. Liver damage, fatty liver, cirrhosis, loss of control, consciousness, health complications, diabetes management, diet, hypoglycemic drugs, insulin, exercise. Goal, maintain normal blood glucose level, carcinogenic agents, cancer-causing substances, carcinogens. Examples, physical irritants like heavy smoking causing lung cancer. Text incomplete. Assertion reasoning examples. 1. Alcohol during pregnancy. Assertion, not desirable. Reason, causes physical mental defects. Answer, both true. Reason is correct explanation. A. Cancer and tumors. Assertion, all cancers result in tumors. Reason, cancer treatable with antibiotics. Answer, both false. D. 3. Cancer is contagious. Assertion and reason, false. Here is your text copied exactly as you provided. I choose the correct answers. Question 1. Which is cancerous tumor? A. Benign tumor. B. Malignant tumor. C. Lymphoma. D. All the above. Answer, malignant tumor. Question 2. The elevated blood glucose level is termed as D. A. Glycosuria. B. Hyperglycemia. Polyphagia. D. Hypoxia. Answer, B. Hyperglycemia. Question 3. Treatment of cancer is surgery. B. Radiation. C. Chemotherapy. D. All the above. Answer, all the above. Question 4. A. Glycolysis. B. Atherosclerosis. C. Ketosis. D. None of the above. Answer, atherosclerosis. Question 5. Which is the gold standard for definitive cancer diagnosis? A. Biopsy. B. MRI. CT scan. X-ray. Answer, A. Biopsy. Question 6. Tobacco chewing is strong linked to which type of cancer? A. Mouth cancer. Lung cancer. Skin cancer. Breast cancer. Answer, mouth cancer. Question 7. Addiction from tobacco is primarily due to A. Caffeine. Nicotine. C. Tar. Carbon monoxide. Answer, B. Nicotine. Question 8. Factor responsible for cirrhosis of liver. A. Viral infection. B. Bacterial infection. C. Alcoholism. D. Genetic disorder. Answer, C. Alcoholism. Question 9. Related to tobacco addiction. A. Gastric and duodenal ulcers. B. Bronchitis. C. Emphysema. D. All the above. Answer, D. All the above. Question 10. Alzheimer's disease affects A. Children, young adults. C. Middle-aged people. D. Elderly people. Answer, D. Elderly people. Correct answer. B. Lymphocytes. B. T lymphocytes. C. Helper T lymphocytes. D. Suppressor T lymphocytes. Helper T lymphocytes. Question correct answer A. Cancer. B. Diabetes. C. AIDS. D. Hypertension. Answer C. AIDS. True false section. 1. Insulin administration is necessary for type 2 diabetes. Answer false. Type 1 diabetes. 2. Hypoxin refers to a decrease of oxygen in body tissue. Answer true. 3. International Day Against Drug Abuse and Illicit Trafficking is on June 26th. Answer false. June 26th is correct. 3. Expand the following abbreviations. 1. POCSO. Answer, Protection of Children from Sexual Offenses. 2. WHO. Answer, World Health Organization. 3. CVD. Answer, Cardiovascular Disease. 4. LISA. Answer, Enzyme-Linked Immunosorbent Assay. 5. NCPCR. Answer, National Commission for Protection of Child Rights. 6. LDL. Answer, Low-Density Lipoprotein. 4. Match the following. A, B, I, D, D, E, V. Fill in the blanks. Child helpline number is 98. Answer 2. Psychotropic drugs are also called as answer, psychoactive substances. 3 is powdered tobacco taken through nose. Answer, snuff. 4. Body mass index. Answer, white puer. 5. Seed contains insoluble fiber. Answer, psyllium. 6. Desirable level for blood cholesterol is, answer, 200 mg per million. The study of cancer is called, answer, oncology. 6. Analogy type questions. 1. Sarcoma, skin cancer. Leukemia, answer, blood cancer. 2. Diabetes, increase in blood glucose. Obesity, answer, increase in body weight. 7. Question 1. Risk factors for illness and early death. Answer, smoking cigarettes, alcohol addiction, use of drugs, eating high fat. If you want this formatted differently, PDF, docx, neat table, etc., tell me. Here is all the extracted text copied cleanly in one place without changes. Page 30 of 266 on human health. A. List any 2 ill effects of tobacco. Suggest any 2 measures on anti-tobacco awareness. Answer. A. Pulmonary tuberculosis and emphysema are caused by tobacco. B. Proper counseling and medical assistance help to give up the habit. Question 2. Which diagnosis is essential for confirming diabetes? Answer. If the fasting blood glucose is greater than 140 milligrams per ddl, or the random blood glucose is greater than 200 milligrams per on more than 2 occasions, it confirms diabetes. #SAYS. Value-based questions. Question 1. Adolescence is a vulnerable phase of mental and physiological development in an individual. They are more prone to addiction at this age. A. Give 2 reasons for addiction in adolescence. B. Mention 2 preventive measures. Answer. A. Peer pressure and mood swing. B. Creating awareness and proper counseling. Question 2. A person in your locality has been diagnosed with AIDS. People in your locality want him to leave the colony for the fear of spread of AIDS. A. List the way AIDS virus be transmitted. Give 2 suggestions to prevent it. Page 29 of 266. Relaxation. Counseling to family members. Social workers counsel family members in order to change the attitude of rejection so that the addict is accepted by the family and society. Rehabilitation. They are given proper vocational training so that they can lead a healthy life and become useful members of society. Question 3. What are carcinogen? Write a note on carcinogenic agents. Answer. Cancer-causing agents are called carcinogens. They are physical, chemical agents, ionizing radiations, and biological agents. Physical irritant. Heavy smoking causes lung cancer and cancers of oral cavity, pharynx, throat, and larynx. Betel and tobacco chewing cause oral cancer. Excessive exposure to sunlight may cause skin cancer. Chemical agents. Nicotine, caffeine, products of combustion of coal and oil, pesticides, asbestos, nickel, certain dyes, and artificial sweeteners induce cancer. Radiations, ionizing radiations like X-rays, gamma rays, radioactive substances, and non-ionizing radiations like UV rays cause DNA damage leading to cancer. Biological agents. Cancer-causing viruses are called oncogenic viruses. #X. Higher order thinking skills. S. Question 1. Ram participated in a group discussion on the topic ill effects of tobacco. Drug dependence section. A. Drug dependence. Persons who consume psychotropic drugs become fully dependent on them. They cannot live without drugs. This condition is referred to as drug dependence. The dependence may be physical and mental dependence. Dependence on the drug for normal condition of well-being and to maintain physiological state. Psychological dependence. A feeling that drugs help them reduce stress. B. Behavioral changes of drug users. Drop in academic performance. Absence from school or college. Lack of interest in personal hygiene, isolation, depression, fatigue, and aggressive behavior. Deteriorating relationship with family and friends. Change in food and sleeping habits. Fluctuation in body weight and appetite. Always looking for an easy way to get money for obtaining drugs. Prone to infections like AIDS and hepatitis B. Drug de-addiction, detoxification. The drug is stopped gradually and the addict is helped to overcome the withdrawal symptoms. The addict undergoes severe physical and emotional disturbance. This is taken care of by specific medication. Psychotherapy. Individual and group counseling is given by psychologists and counselors. The treatment includes efforts to reduce the addict's stress, taught new ways to solve everyday's problems, adequate diet, rest, and text cutoff. IX. Long answer questions. Question 1. List out the behavioral changes of drug user. Answer. Adverse effects of drug use among adolescents are 1. Drop in academic performance, absence from school or college. 2. Lack of interest in personal hygiene, isolation, depression, fatigue, and aggressive behavior. 3. Deteriorating relationship with family and friends. 4. Change in food and sleeping habits. 5. Fluctuation in body weight and appetite. 6. Always looking out for an easy way to get money for obtaining drugs. 7. Prone to infections like AIDS and hepatitis B. Question 2. Explain the following. A. Drug dependence. B. Behavioral changes of drug users. C. Drug de-addiction.